The idea of senolytics, drugs that target and eliminate senescent or zombie cells, has taken the aging research world by storm. These dysfunctional cells stop dividing but refuse to die, leaking inflammatory chemicals and tissue-degrading enzymes that contribute to everything from arthritis to cancer recurrence to cognitive decline. It's tempting to think we should just wipe them all out. But the deeper we look, the more it becomes clear. Not all zombie cells are created equal. Some are inflammatory nightmares, others are tissue repair supervisors. And blasting them all with the same pharmacological shotgun may be doing more harm than good. Enter the age of precision senolytics, a new, more sophisticated approach to senescence therapy, one that doesn't just kill zombie cells indiscriminately, but learns to recognize their identities, sort them by function, and hit the truly harmful ones with surgical precision. It's not about a cure-all anymore. It's about a targeted culling of the worst offenders, one cell type at a time. The first step in this strategy is understanding that senescent cells are incredibly heterogeneous. A senescent fibroblast in the skin is nothing like a senescent endothelial cell in the heart or a glial cell in the brain. Even within the same tissue, senescent cells diverge based on how they became senescent. Radiation, telomere shortening, metabolic stress, or inflammation each leave their own molecular fingerprints. Some express high levels of anti-apoptotic proteins like BCL-XL, while others rely on different survival pathways. Some pump out inflammatory cytokines like IL-6 and IL-8, while others lean toward fibrosis or metabolic disruption. Trying to treat all of them the same is like giving the same prescription to every patient in a hospital ward. To solve this, researchers are now leveraging multiomics, simultaneous profiling of transcriptomes, proteomes, metabolomes, and epigenomes to build high-resolution maps of senescent cell subtypes. These maps don't just reveal what the cells are doing, they show what keeps them alive. If one subtype depends heavily on the PI3K, AKT survival pathway, a targeted inhibitor might work. If another is addicted to P21 signaling, that's a different therapeutic handle. The goal is to build a library of molecular vulnerabilities matched to specific senescent cell states, and develop drugs that exploit them with minimal collateral damage. This is where AI-designed drug libraries come in. Traditional drug discovery takes years and often misses subtle patterns. But deep learning models trained on massive multiomic datasets can now propose candidate molecules that match the unique survival wiring of a given senescent subtype. These algorithms don't just identify promising molecules, they optimize them, predicting solubility, toxicity, and even how well they'll penetrate different tissues. Need a brain-penetrant senolytic that targets senescent astrocytes but not microglia? AI can help you design one. Want to eliminate senescent liver endothelial cells without harming hepatocytes? The models are already in the works. Some of the most exciting advances are coming from dual-target strategies, designing drugs that only activate when two conditions are met. For example, a compound might only become cytotoxic in cells that express both a senescence marker like P16-INK4A and a survival protein like BCL2. This and gate approach dramatically reduces the chance of harming non-senescent cells. Other approaches involve using prodrugs, inactive compounds that are only metabolized into toxic forms by senescent-specific enzymes, such as SS-galactosidase. Even delivery systems are getting smarter, with nanoparticles that home in on senescent cell surface receptors or bind to ECM changes unique to aged tissues. Another emerging tactic is to design tissue-specific senolytics. Instead of system-wide clearance, these drugs target senescent cells in a single organ or tissue. This could be game-changing in cases like idiopathic pulmonary fibrosis, targeting senescent fibroblasts in the lungs, diabetic nephropathy, targeting senescent podocytes, or chemotherapy-induced heart disease, targeting senescent cardiac endothelial cells. It allows for high efficacy and low systemic toxicity, especially critical in elderly or fragile patients. Crucially, precision senolytics could also be adaptive. By monitoring biomarkers in blood, skin, or even breath, future treatment systems could tailor senolytic dosing and composition to each individual's current senescent cell burden. Think of it like a metabolic fingerprint scan, followed by a personalized zombie cell takedown. This kind of precision will be especially important in balancing risk. Clearing too many senescent cells too fast could cause tissue instability, while leaving the wrong ones behind could worsen disease. And beyond killing, there's growing excitement around senescence reprogramming, techniques to push senescent cells back into a quiescent or semi-functional state. If we can eliminate certain senescent subtypes without harming tissue integrity, we might still be able to tame them. AI-guided discovery could play a huge role here too, identifying compounds that selectively quiet the SASP or reactivate partial proliferative capacity in non-dangerous cells. In the end, precision senolytics represent a new philosophy in anti-aging and regenerative medicine. It's not about purging all senescent cells, it's about understanding them, down to their molecular essence, and designing tools clever enough to differentiate between a harmful saboteur and a helpful repair worker. This is a future where your anti-aging pill isn't one size fits all. It's built for your organs, your senescent signatures, your cellular clock. The zombies are still here. But now, finally, we know how to find the bad ones, and we're learning to take them out one at a time.